Well, by the time New York City confirmed its first coronavirus case on March 1st, thousands of infections were silently spreading across the city. These hidden outbreaks were modeled by researchers at Northeastern University who shared their results with the New York Times. They say spread was almost completely undetected in places like Boston, Chicago, San Francisco, and Seattle long before testing showed each city had a major problem. Well, to date, just over 4.5 million COVID-19 tests have been administered in the U.S. That represents just over 1% of the country. Now, the Rockefeller Foundation, one of the largest private donors in the U.S., is rolling out its proposal for a national strategy. Its goal includes reaching 30 million coronavirus tests per week, hiring up to 300,000 people to do contact tracing, and creating a digital sharing platform to encourage the faster spread of data. The Rockefeller Foundation thinks a plan will cost $100 billion. It's investing $15 million toward that project. Well, now I want to bring in the Rockefeller Center Foundation. One of the largest private donors in the U.S. is rolling out its proposal for a national strategy. The goal includes reaching 30 million coronavirus tests per week, hiring up to 300,000 people to do contact tracing, and creating a digital sharing platform to encourage the faster spread of data. The Rockefeller Foundation thinks this plan will cost $100 billion. It's actually investing about $20 million towards that. Raj Shah is the president of the Rockefeller Foundation. He formerly worked as the head of U.S. Agency for International Development under President Obama. Raj, thank you so much for joining us now. Can you give us a sense, why is it that the United States has lagged so far behind other countries with coronavirus testing?
Well, thank you for having me. The reality is America has lagged behind South Korea, Iceland, Germany, and perhaps half a dozen other countries in just making tests available for diagnostics, the very direct PCR test to identify whether or not someone has coronavirus. I think the reasons for that are many and have been well documented, but probably the biggest reason is America has a healthcare system that has underinvested in public health and laboratory surveillance for public health, perhaps at the expense of building, the world's best acute care and tertiary care health system in the world. The Rockefeller Plan is a very clear action plan that was developed actually not by the foundation, but by experts from science and industry, from former government officials in the Democratic administrations and Republican administrations, who've come together and said, here are a practical, pragmatic set of actions to get from 1 million to 3 million to 30 million tests per week, because we believe that's what it'll take to protect our economy and protect lives for American families.
I think that's what really surprised me about this plan, was just how expansive the expert list was that you drew from when putting this together. Why do you believe that this plan will really make a difference at this point in our country?
Well, we've been stuck at 1 million tests per week for the last 3 weeks, and we're not seeing upward progress. When we talk to lab directors and mayors and governors around the country, they're having trouble accessing supplies. They're having trouble tapping into their own lab capacity, and the system's just not working as well as it needs to. So the proposal we've put forth is very practical. 2/3 of America's molecular testing capacity resides in small labs and research labs and university labs that are underutilized for the task of diagnosing COVID-19 and reporting those results quickly and efficiently. We've proposed a system to bring those labs online, to connect them to requisition and results reporting systems, and to make sure they get appropriate reimbursement. We've also proposed a procurement platform that would allow states and mayors and governors to join together and say, instead of buying product through lots of distributed small-scale labs, let's get together and place larger, longer-term purchase orders so that the suppliers like Abbott and others, Roche, can make enough supply, not just for today's level of testing, but for what we need in November, which is 30 million tests per week. And that's a big, big lift, but it's really the only way to get the American economy working in a functional way for America's working families.
30 million tests per week is a very ambitious agenda. How confident are you that you can really roll something like this out?
Well, I'm very confident. I led the West African Ebola response, and America got testing down from 8 to 9 days for Ebola down to under 4 hours. And we did it by deploying thousands of American troops, putting laboratories throughout West Africa, and just focusing like a razor on testing and diagnostics and specific contact tracing. We can do that in America. We've actually had a lot of experience coming together for antiretroviral drugs or for global access to vaccines in pooling together the demand side of the industry, doing deals with the supply side of the industry to say, hey, we need a 10x or 20x or 30x increase in volumes. And at those higher volumes, we should get better prices. So moving the market from a disaggregated, low volume, highly constrained space to a place where we're actually producing enough tests so every American can get one and the government can reimburse for it effectively is probably the single most important thing we have to do right now to address the effort to restart the economy while we live in a world where we have COVID-19, but we don't have a vaccine.
It's actually comforting to hear you say that this has been done before, that the United States has been able to move fast on testing. It just all feels so new on so many instances. You mentioned your ability during the Obama administration of dealing with the Ebola crisis. What are you watching in the coming months that you think might help us tell the direction of where we're going with all of this?
Well, of course, you're looking at core prevalence data to say where are the new cases, how many total cases do we have, what's the fatality rate amongst those who have been diagnosed with COVID-19. I think critically we watch metrics like ICU capacity and treatment capacity. But I would argue that the focus needs to now shift to a real focus on testing, and we should be tracking and reporting the number of tests per week. We need to get to 3 million in 8 weeks. Those tests need to be distributed effectively, so not everyone should get a test, but as we start to scale up testing, we should have more people who don't have symptoms but are risky, either because they've been in contact with someone who's been a confirmed positive, or because they're a healthcare worker or some other type of essential worker. They need to know so they can go to work and be safe, and their colleagues at work can be safe, that they are either positive or negative. And so a protocol and looking at the number of tests per week executed per that protocol is something we look very closely at to see, is it safe to reopen parts of the American economy? And this is urgent. We're at war with a virus, and our mindset is let's all come together across federal, state, and local divides, across Republican and Democratic divides, and importantly across industry and public health, to solve this problem together, because it demands that kind of cooperation.
It certainly does. Raj Shah with the Rockefeller Foundation. Raj, grateful you could join us.
Thank you.